Okay, thank you for inviting us. My name is Parth Narendran. I'm Professor of Diabetes Medicine at the University of Birmingham and Chief Investigator for the ELSA study, Early Surveillance for Autoimmune Diabetes. And I'm joined today by Beth Baldwin as well. So Beth, over to you. Tell us a bit about yourself and why we're here.
Hi, I'm Beth Baldwin. I am mum to Peter Baldwin, who very sadly died from type 1 diabetes at DKA diagnosis in 2015. We're really grateful for Dr. Ambika Shetty to inviting us here today. We're lucky to have such an expert and such a passionate advocate for type 1 care here in Cardiff and the Vale, and we really appreciate being given this short time to tell you a little bit about what we have planned.
Thanks, Beth. So there are many advantages to identifying children and adults at risk of type 1 diabetes. A big one, of course, is reducing the risk of diabetic ketoacidosis. Currently, about a quarter of our children who are diagnosed with type 1 diabetes and get to diagnosis are diagnosed in diabetic ketoacidosis. And being warned about it, being aware of it, is a very effective way of making a diagnosis and also reducing presentation in diabetic ketoacidosis. So that's a really important reason, and probably the primary reason we're here today. There are other reasons, of course. One is that children who are diagnosed through screening are picked up earlier in the natural history of diabetes. They have a lower blood glucose at the time of diagnosis, lower HbA1c, more C-peptide, so they've still got more beta cell function at the time they're diagnosed. And the diabetes control they have in the first few years are better. The other big reason, which has come to the fore in the last year, is the licensing of a therapy called teplizumab, licensed in the US for delay of type 1 diabetes in children and adults at risk of type 1 diabetes. So it gives us a chance to intervene and to offer immunotherapy to people at risk. And that's what we're doing with the ELSA study. So the ELSA study is a screening study. It stands for Early Surveillance for Autoimmune Diabetes. What we are doing is offering a finger prick test to all children in the general population who don't already have type 1 diabetes and who are currently between the age of 3 and 13. And this is a finger prick test that can be done quite simply at home or through schools, but also through primary care practices. And this is it's a study that's now open to primary care practices across Wales for patients in your practice who may want to screen for this. Currently, most of the families who are stepping forward already have a family history of type 1 diabetes, but it's also important that we screen people without a family history. Remember that 80 to 90% of people who develop type 1 diabetes will not have anyone else in the family with type 1 diabetes. So this is available through your clinical research network for implementation, or you can find out more about the study through us. That's elsadiabetes.nhs.uk. So that's one of the things we're trying to do to identify children at risk and to prevent the sorts of things that happen to Peter. But also, Beth, would you like to share the other important thing that you're driving across Wales on this issue?
Yes, thank you, Parth. 8 years ago, when we lost Peter, we didn't have any knowledge of type 1. We didn't really see any posters. We didn't know anybody who had type 1 diabetes. So it was completely not on our radar, not something that I considered. So when we took Peter to the GP as a 13-year-old, fit and healthy, with a chest infection, cough and cold, they gave antibiotics and sent us home. Within 24 hours, Peter was dying. He was in DKA, and unbeknown to us, we had no idea. So we phoned 999, and the first responder, after giving Peter oxygen, pricked his finger and told us he was likely type 1 diabetic and in DKA. Since that day of losing Peter, We have campaigned tirelessly as a family with support of Diabetes UK Cymru to prevent this from happening from another family. So in the beginning, we asked for a screening programme, and 8 years ago, we were told that we were ahead of our time and the testing wasn't accurate enough. But as you can see, in the last 8 years, there have been massive waves made by the likes of Professor Parth. And now, just 8 years later, we're in a position to be able to offer this. So we were emotionally overwhelmed when we heard of this programme, because it's everything that we hoped would come to fruition from our campaign. So we are launching in the spring, Rewrite Peter's Story. And it's for GPs like yourselves to appreciate the complexities of type 1 diabetes and just look out for it, to have it on your radar. So when a child presents with a tummy bug, with cough, cold, chest infection, anything that just doesn't seem right, you ask the simple 4 questions, the 4 Ts: toilet, thirsty, tired, thinner. Is the child weeing more, lethargic, lost a bit of weight? These 4 questions, these 4 Ts, if any of the answers are yes, please, please, please prick the finger of that child. Instant blood glucose test, not sent away for a hospital test a week's time, no 10 days fasting, etc. Not 10 days fasting, fasting testing that takes 10 days then for the results to come back. Please ensure it's instant, because you can detect a child straight away. And as Professor Parth has said, the outcomes for speedy, prompt diagnosis are so much better for children. We're going to produce a series of resources, including some online presentations, videos, some merchandise for you, and hopefully we'll capture everybody and each of you GPs will have something to be able to use. We'd love your feedback on this. So if there's anything that you think we could be adding to, or a different way of approaching, I'd really like you, as a call to action, to rewrite Peter's story. So the next time a child comes into a practice with suspected type 1 that might be masked by just common ailments, common illnesses, you just ask those questions. And yes, 99% of the time you'll prick that child's finger and they won't have type 1. Their blood glucose will be normal. Then you can proceed to explain about the screening programme that could prevent them from becoming unwell in the future if they are type 1 in the future. What do you think, Professor Parth? Have we covered?
I think we've covered all the very salient points there, Beth. Thank you very much. Really powerful words. Thanks, Beth, for sharing that. And we hope you find this useful, and please do implement and rewrite Peter's story.
Thank you.